Interprofessional Collaborative Care. What is interprofessional learning? IPL. To be a successful healthcare practitioner within your community, you need to collaborate across a range of different professions and present interprofessional collaborative care. This can be accomplished by interprofessional learning, IPL. It is defined as occasions when two or more professions learn with, from, and about each other to improve collaboration and the quality of care. Why is IPL important? Multidisciplinary teams work together to manage patients with chronic and complex health conditions. Without this collaborative care, it will be extremely difficult to provide optimal care for patients. IPL improves interprofessional teams, health services, job satisfaction. This is achieved by expressing respect and understanding the roles of other health professions. This can make a pleasant workforce environment. Finally, IPL improves patient health outcomes. Victoria Kimblier and Daniel Pilker are examples of what can happen if there is lack in interprofessional collaborative care. 80-year-old Victoria died in 2000. She was tied up, burnt with cigarettes, and beaten with bike chains by her guardian. Lack of communication between social workers, nurses, doctors, and police officers allowed her guardian to torture the little girl to death. Many professionals involved in this case admitted they were overwhelmed by their workloads, received low pay, and did not communicate with one another. Another case with Daniel Pilker depicts what happens when there is a lack in interprofessional collaborative care. On his last day of school, he was desperate for food. He tried to eat play jelly and ate a half-eaten pear from a bin. 2 days later, the 4-year-old died. His plunge from a happy boy to a painfully thin child was neglected and missed by healthcare professionals, social workers, teachers, and police officers. The authorities had at least 7 opportunities to uncover the level of abuse against Daniel in a series of home visits and investigation. Despite teachers' concerns, the child was never taken away from his guardians. How to have successful interprofessional collaborative care. In rural and remote areas, like your community, attention to interprofessional teamwork is particularly important. I will introduce 5 key factors to assist your healthcare providers to gain success in teamwork. Positive interdependence. You must be able to work as both a team leader and a team member to accomplish a goal. Individual accountability, where everyone must hold their own weight. Promote interaction. This prevents fragmentation within your team, and fragmentation can lead to misunderstandings and reduce the quality of healthcare services. Interacting also helps to express opinions to colleagues, and if this is done correctly, it can prevent conflicts. Group processing. This involves having a discussion and reflecting with your team. This reflective practice can support interprofessional learning outcomes and assist to discover ways to improve. It also helps to identify everyone's roles, responsibilities, and expertise for clarification. Development of teams' interprofessional skills. Improve your interprofessional skills as a team because some people do not automatically acquire this ability. Conflict management. In unfortunate events, conflicts may arise. This is because of 3 main reasons: competition, misunderstanding, and historical events. This can be resolved by a principle called win-win negotiation. You can compete, avoid, or omit to solve your issue, but those are win-lose options. As you can see, collaboration is a win-win solution. If you are able to achieve these conditions, your community will gain improved healthcare services. The following video depicts the benefits of interprofessional collaborative care for different professions.
The role of an audiologist is basically to assess people's hearing and develop rehabilitation programs for them. We work with other professionals as well, advising them about clients' hearing problems and also strategies to try and counteract this or help them communicate better.
Working with other healthcare professionals is a huge part of my position, so communication is very important as a dietitian. We have regular multidisciplinary meetings which involve nurses, other allied health including pharmacy, speech therapists, occupational therapists, medical staff and doctors to discuss plans for the patients, discharge planning and outcomes, and to ensure that we're all working towards one goal for the patient.
A nurse's role is very diverse depending on what area they work in. Nurses relate to other healthcare professionals in regard to coordinating patient care. So if we identify areas of need or areas in regard to patient care that need attention, we can contact and liaise with the appropriate professionals such as social workers, occupational therapists and physiotherapists to arrange the appropriate care and outcomes. And we do this in order to provide the best possible care for patients.
With the help of good reflective practice, if IPL and IPP are successful, it will result to excellent interprofessional collaborative care, consequently leading to optimal healthcare services in your community.